Hi friends, welcome to Nurse's Learning Guide. Today's topic is below elbow slab or splint. We will discuss about the technique and application and the materials used for it.
The back slabs or splints are used to support and protect the injured area or extremity or to stabilize a fractured area, to reduce the swelling or pain. Also is used for post-operatively for specific conditions. How to avoid complications? It needs to be applied by the back slab or splint by the trained professionals. Need to have a proper training and need to apply splint correctly by using proper technique. The final one is your assessment, the post-casting or post-splinting assessment. The patient needs to be assessed properly before the patient leaves the room. You need to assess the neurovascular assessment. The patient is comfortable. Make sure that the patient is comfortable. So we are going to apply below elbow cast, otherwise it's called as volar or posterior splint. You just need to make sure the physician order. Check the physician order properly. Make sure the placement of the slab where it is. It's if it is a dorsal side or the volar side, you need to make sure before you start applying. Equipment need for application, we need a stockinette, proper cast stockinette, but not to use tubular bandage. As you all know, that tubular bandage may cause, if you don't release the pressure on it, and it may cause additional pressure on the hand. So better used is proper stockinette. Next is cotton bandage soft roll or cotton roll. Plaster slabs are pre-padded fiberglass or polyester splint. Today we're going to use polyester splint. Room temperature water. If you are beginner, better not to use the water because it dries quickly. If you use the water, it dries quickly, so better not to use if you are a beginner. Crepe bandage, Lister bandage scissor, then your adhesive tape to secure it. When you select the sizes, there are different sizes are available for each items. If you take the stockinette or the cast, we have different sizes like a 3 to 4 inch, 2 inch, 1 inch, 6 inch for thigh. Usually we prefer to take a 4 to 6 inch for the thigh areas, and 3 to 4 inch for the lower leg, 3 to 4 inch for the upper arm, 2 to 4 inch for the forearm. Remember to choose the appropriate size by looking at and physically when you see the patient. Size, once you practice a couple of times, you will be knowing which size you have to choose. You may choose appropriate size accordingly. Coming to the types of cast materials used, as earlier we discussed, we do have plaster patties, fiberglass, polyester cast, soft cast, wood cast. Each one serves its own purpose. So we choose the cast according to the condition and the situations, up to the orthopedic doctors and the technician who applies. For today's application, below elbow slab or splint, we need to collect all the equipments. We're going to use polyester 3-inch splint and soft band or cotton roll, stockinette. Need to have crepe bandage and Lister bandage scissor. Before we start applying, you need to do the initial assessment. First, identify the patient and the location of the fracture and verify the order. Assess the skin condition. Make sure that there is no wound. If so, then we need to do the dressing and document properly. Remember, if you do the dressing, then it's better to start with the cotton bandage instead of stockinette. You may use 2 or 3 layers as required. Also check for any allergic condition. If the patient is allergic to any kind of materials, then we need to be notified and taken precautions for it. So we start applying. The first one is the stockinette. You can see the stockinette. If you are not aware how to apply the stockinette, just watch my previous below elbow cast video. The next one is the cotton. While applying the cotton, just make sure you are not to be too tight or loose. One third of application should be followed. Once you reach to the thumb area between the thumb and index finger, just tear it to release the pressure. So this will reduce the pressure over on the side. You can use A1 the scissor and just bring it down and finish the roll. You can see how the roll goes, and just bring it down and finish the layer. Coming to the splint, you can see the splint. This is a polyester splint. If you are not sure about how long you need to cut it, you can just follow this tricks. You can see it on the screen how I'm measuring it. If you are a beginner and if you have doubt on it, then just follow these tricks. You may use the Lister bandage scissor, proper bandage scissor, to cut it and take out. And the remaining part, just make sure you will just close it properly, because if you don't close it properly, the air will enter, then the whole box will get damaged. So make sure you will properly sealed. Just push it inside. You can see it, 3 to 5 centimeters is much better if you leave the area free space. Then just lock it. You can see it, like you can see it. Just lock it and seal it properly so the air will not enter inside. Take out the splint. You can see the padded area. Always try to apply the padded area to the hand. For start applying, just make a mark like this in the proximal and the distal area of the thumb, just to avoid the pressure and the sharp edges. Coming to the lower part, you can see the extra portion. Just make sure that you will cut it. I've seen people folding, and folding may cause extra pressure points, so it's better to remove it completely. So you may use the listro bandage scissor. You can see it. Make sure there is no sharp edges. Coming to the proximal area where we marked it, near to the thumb area, just make C-shaped cut. You can see it. Use a nice listro bandage scissor to cut it. Then make sure there is no sharp edges, and place it and see. Next is water. As I told you before, that if you are a beginner, it's better not to use the water. It may dry quickly. So if you are using the water, you don't need to dip it completely. Just take a drops of water and spill it inside and squeeze it. Now you bring it back and now start applying the crepe bandage. You can see the crepe bandage. While applying the crepe bandage, just follow the bandage principle, not to be too tight or too loose. Now while reaching to the thumb area, just make a precaution that you will not fall between the index and thumb finger. Just make a hole like this and bring it down. You can see it again, the second layer as well. Just make a space, enough space and not to squeeze it. Just make a space like this and bring it down through the thumb finger. Once you complete the layer, just use your stockinette. Just fold it back. So this will avoid sharp edges. It will give a soft padding, and the proximal area as well. Make a hole and bring it through the thumb. And now you can see it's free. MIP joints are free. Now it comes to your final layer of crepe bandage. If you want to mold it, just make a required molding. Now the final layer, you can start from 1 to 2 centimeter away from the stockinette. While applying, the same principle has to be followed. Once you reach to the thumb area, just make a hole like this and bring it down. Just make sure that you will have enough space. Then finish the layer and secure it with adhesive tape. Then you can see the elbow joints are free to move. Now we complete our below elbow slab. You can see the patient is able to move the fingers freely. The thumb side is free and there is no sharp edges. The elbow joint is free to move as well. You may place the patient in an arm sling if it's required so. Next is cast care instruction. It's very important to educate the patient post cast care instructions. If you are not aware about it, please watch my previous below elbow cast application video. Hope you enjoyed. Thank you so much for watching and support. It's me, Jijo, signing off from Nurses Learning Guide. See you soon with another video. Thank you and good day.